I think we have a lot of questions of, what I heard this morning about the effect of pharmacogenomics, genetics on the drugs we develop. It is a very central question to us in terms of science. So it's very important that we make this case strongly. What also is of a problem we have faced in everything we do, and that was mentioned also this morning, is the traditional medicine topic. Because every single patient that we enroll in a clinical trial for NTDs, every single patient first, in our experience, at least in Africa, systematically will go to the traditional healer. Because that's the culture and that's what they believe in. And so we have a lot of scientific and, I would say, social questions to ask ourselves around this traditional medicine. How can we combine both attitudes to traditional medicine? How can we understand what is good, what is not good? How can we make solutions for patients holistic enough so that we don't come as breaking or changing something? It will not work if we don't understand in what context we operate. So it's very key that we hear more about this. And that we take traditional medicine for its value, so the good and the bad of traditional medicine. So I think the declaration today for me is really, it's enlightening because it really puts emphasis on questions that we have had and we don't really know yet how to address these questions. So we need more work on this, we really need that. The third point of the declaration is about making sure there is an environment that is conducive to research so that all the questions that come from the field are addressed by the field. And it's not coming from outside, it's bringing people to obtain the tools, the knowledge, the know-how, how to respond to questions they ask themselves. And so I think we already had good examples and presentation also from the live and learn from the India colleague. So that was, I thought, super interesting because that's the best way. You as young students, you will not come with an artificial view of things, but you will understand and bring and mix and match competencies. And this is a little bit how we work. We try to get the competencies where they are. So it's very key. Because as Dr. Rago said, at the end of the day, life improvement is related to health improvement, but health improvement also means research to everyone. And of course, the poorest and the poorest or the vulnerable have less access to research that is dedicated to their problems, not to the problems of everyone. And it's so good that we now see which are the differences, the biological ones, the social, cultural ones. So what we are trying to do at CIOMS is to facilitate, understand what are the obstacles to conducting research, all the obstacles, the scientific, the ethical, the political, the financial ones, and see how to provide some kind of framework to address these challenges. So I think that's what probably what I can say about this. But I'm very honored to be part of this group because I think we have a lot of privilege to be here and very honored to meet the people we met this morning and we listened to this morning, sincerely, because we don't have this. I can tell you that one of the key questions we ask ourselves is how do you find patients that would be patients representative, that are vulnerable patients, that you would not instrumentalize because suddenly you have your patient. He's the patient that represents all the vulnerable ones. How do you find the right balance of finding someone that can be a representative of its community, and contribute? How do you do that? It's still big questions that we have. For HIV, you have patients' associations, right? They're very strong, they're very knowledgeable. For vulnerable populations, where and how do you find them? And if you can help us, we'll take the help for our research, because we need that.